Okay, good.
So I think we can start. Thank you all for joining today as well. The presentation today is for another product that you will be distributing in Iraq. I'm going to share my screen, and yeah, let me know if you see it well. The computer is a bit slow today. No, okay. Okay. Okay, so the product that we will be discussing today is AB Colicare. This is a probiotic formula that we've developed for babies specifically. As yesterday, I'm going to first start with a small table explaining the characteristics of the product. Marta will then explain after my session all the evidence behind the strains and why we chose these strains to develop this specific product. AB Colicare has 3 different ingredients. It has a B. longum strain, a P. pentosaccus strain, and then vitamin D. The main indication is infant colic. You'll see that we also recommend sharing the product with other kinds of babies, of patients, but the main indication is infant colic.
Claudia.
Yes. Yes.
Sorry, our product doesn't contain vitamin D.
Ah, okay. Okay, my
Yes.
mistake then. I apologize.
Thank you. Thank you.
Okay. I'll change it on the slides. Well, vitamin D is a product that we sometimes use in other markets for this particular formulation, but the main benefits rely on the strains, and all the clinical trials that Marta will share afterwards are done without the vitamin D. Okay, so testing only the probiotic formula, so you don't have to worry in that sense. Okay, so main indication is infant colic. The product has been tested in several trials in babies that have infant colic. Marta will explain a bit better the pathology, but as you know, is babies that cannot stop crying or that cry for long periods of time during, from 3 to 5 months old is when this pathology is very common. The format are drops. In the 8 milliliters that you get of the product is around a 30-day treatment. It's 5 drops a day, once daily. And the recommended treatment duration is at least 1 month. For this particular product, we do have clinical evidence that it works after 1 week of use, meaning that it has significant differences versus placebo after only 1 week of use. This is a very strong message that is also unique in the market. Other probiotics for colic do not observe significant effects until much later on, 2 weeks or even 3 weeks or a month of treatment. So I would suggest to use this message a lot when promoting the product, the fact that it's of very fast effect, which is also very important in infant colic, where parents are expecting an immediate response on the time of crying, okay? And then consumer profile, main consumer profile would be, of course, babies from 0 to 5 months of age. We also say 0+ months because this probiotic has been shown to be completely safe and can be even given to newborns. So this would be also a very strong message to highlight. Okay. This slide tries to synthesize the key benefits of the product. All these benefits that are showing on the screen have been clinically tested, but as a very, let's say, big summary, the product works increasing the populations of gut bacteria in the gut. These populations of gut bacteria in babies are called bifidobacteria. This is a species of bacteria that's incredibly common on the guts of healthy babies, and it keeps reducing as babies get older. But for babies and toddlers, bifidobacteria are the most important bacteria on their guts, and they make sure that they have a healthy development and impact many areas of health, including immunity and, of course, digestive health as well. So we've seen that AV colic care increases these populations of bifidobacteria in the gut, and this in turn helps the baby counteract several symptoms of infant colic. I've put here the main benefits that we've observed in clinical trials when it comes to symptomatology. We've seen it reduces crying and fussing time and also crying and fussing frequency. So this would be that the baby cries less and less times during the day, so it has less episodes of crying. And we've also seen it not only works in infant colic, but also in other functional gastrointestinal disorders in children, in babies, mainly functional constipation. So it would help also with constipation, even diarrhea and bloating. Okay. Also, something very interesting that we've seen on our trials is that the probiotic works very well on both formula-fed and breastfed babies. This would also be a differential message because there are other probiotics in the market that only have benefits observed in breastfed babies. Okay, and also something very interesting that we've seen on clinical trials is that all these benefits that the product brings to the baby help parents as well. We've seen that while and after a month of treatment with colic care, parents have less anxiety, which is of course associated with the health of their baby. Okay, so this would be a very quick summary on how the product works and its benefits. Another very interesting slide, if it lets me move, is this one. Okay, so here are some numbers also extracted from the evidence that we have of the product. The product is able to benefit 9 out of 10 babies. This is around 97%. We've seen this in a pool of more than 100 babies. So we've seen that babies experience that 9 out of 10, almost all babies, after taking the treatment for 2 weeks, experience at least a 50% reduction in crying time. This is what we call responders rate. So 9 out of 10 babies respond successfully to the treatment. This is a very high number also when comparing the treatment with other probiotic products or other drugs for colic. Okay. We've also seen an average reduction of 150 minutes of crying daily after only 1 week of treatment. This is more than 2 hours of less crying a day after taking the product for only 1 week. This is shown to be the fastest acting probiotic for colic, outperforming the main competitor. So the latest publication that we've done with colic care that Marta will explain in detail, we compared the efficacy of our product with the main competitor, which is called Reuteri Protectis. And we've seen that our probiotic significantly reduces more crying time and fasting time than this other probiotic. We've done a direct head-to-head trial, which is a first. It's quite innovative on the probiotics industry, and we've seen very good results. So you could also say when promoting the product that it's the fastest acting probiotic for colic with quite incredible results after only 1 week of treatment. Okay. We've tested the probiotic in several clinical trials. The most important ones are two, this that I just explained, and another one that we performed a couple of years ago. And when we sum up the populations of both trials, it adds to around 150 babies. And also another important message to highlight is what I have already explained. It's completely safe for babies starting at 0+ months old. It has all European and US health certificates, and it can be considered safe even in big amounts. Okay, so this would be also a very interesting point when highlighting the product. Okay. So moving on to patient profiles, of course, the main patients that can benefit from AV colic care are babies that suffer from colic. This is a very common pathology, as Marta will explain. It affects almost half of babies, and well, it resolves over time, but during the months that babies are suffering from colic, both babies and parents suffer a lot. That's why it's a great way to treat the disease, this specific probiotic. The recommended age for, of course, would be from 3 to 5 months old, and the dosage is very simple. It's always the same. It's 5 drops daily until symptoms disappear. It can be used continuously to prevent the recurrence of symptoms, or used only during those weeks where the baby cries the most. Recommended treatment duration would be 1 month, so until the bottle is empty. Okay. These other two patient profiles, we also put them here so that to increase the patient pool. We've seen, thanks to the mechanism of action of the product and also the evidence, that it may work for babies that are fed exclusively with formula. As you may already know, formula-fed babies have a poorer gut microbiota, so breast milk brings a lot of nutrients to the microbiota of these babies, that help them grow a diverse microbiota, which will impact their overall health. So for formula-fed babies, this product could be very beneficial to prevent pathologies over time. So we would also recommend to tell pediatricians to pair the probiotic with a formula recommendation, just as a preventive measure. Okay. Of course, this is a secondary indication. The main indication is to treat symptoms of infant colic, but it would also work for more innovative doctors and pediatricians, and for those parents that are looking for preventative measures for their babies. This is a completely natural treatment. It's not considered a drug, so it can be given for long periods of time, and it would help and support the development of gut microbiota of babies. Okay. And also another patient profile that it's interesting to mention are those babies or even toddlers, so up until 1 or 2 years of age, that are at higher risk of developing digestive disorders. This would also be a preventive treatment, and it would be given to babies that are treated with antibiotics or that are even born with C-section. These babies have unaffected and less diverse microbiota, and this could impact their overall health. So again, it would be a preventive treatment for babies that have a poor microbiota to increase the populations of bifidobacteria, which are the most, let's say, the most beneficial bacteria for babies and toddlers. Okay. So I also added this slide to talk a bit about the prescribers of colic care. Of course, main prescribers would be pediatricians, so that would be the target audience to promote the product to, because pediatricians constantly see babies with colic and other digestive issues. So we would recommend to promote the product as a treatment for colic and also other functional gastrointestinal disorders like constipation. But then another interesting prescriber here that we've seen works recommends the product a lot in other countries are midwives. So midwives are those that are with the mother during delivery and that also give her some tips just after delivery. Midwives are a great target to promote the product to, because they are able to recommend colic care after the baby is born, and mothers really follow the advice of midwives. And of course, pharmacists would also be a very interesting target audience as a prescriber, because many mothers do not go to the doctor when the baby is crying a lot or feels a bit unwell, and go to the pharmacy directly. Okay. For this kind of prescriber, you could also recommend the product as a prevention treatment, not only to prevent colic, but also other digestive issues, and also to strengthen the function of the gut and microbiota development. Okay. Also interesting, when we've seen how parents interact with their babies, you can also promote the product directly to parents, to mothers and fathers, because when a baby is just born, they are very closely monitoring their health, and sometimes they are actively looking for solutions or for treatments to support their baby's health, even if the baby is healthy. Okay. I also wanted to add a slide talking about the formula used and the format. So something very interesting about both probiotics found in AV colic care is that they are of human origin. The products that we talked about yesterday as well, but for babies is even more interesting to highlight, because this means that the probiotics are completely safe and they thrive in the gut. They grow very well in the gut, which is an interesting and important fact to highlight when talking about probiotics. It's also very important that probiotics, survive gastric acid conditions and arrive to the gut alive. For AV colic care strains, we've seen that they do that, and when they reach the gut, they grow very well. Both strains were isolated from healthy babies and also breast milk, which, as I have said, is a very important source of nutrients for the baby and for the growth of and the maturation of gut microbiota. The formula, well, the format is an 8 milliliter vial, which closest to around 1 month treatment. It has all safety certificates, as I have explained. And also something interesting, you can recommend mothers to mix the product with milk or to give the product directly through the baby's mouth. This is possible thanks to the rubber dropper, which is a blue dropper that can be sterilized. So mothers can decide how to give the product to the baby, which is quite useful as well. And then, as we also commented yesterday, the product is allergen-free. The probiotic is suspended in sunflower oil, which is which gives the probiotic complete stability, and no more ingredients. So it's a very clean label formula that, it's completely safe for babies. Okay. I also wanted to add this here. This is the format where the probiotic comes. This is an illustration that we did to explain the mode of use, how the product should be administered. It's very easy, but well, in case you want it as well for the promotion of the product, we can share it with you. The first time that you open the product, you need to change the cap. So it comes with a small cap, and you need to put the rubber dropper in it in order to be able to administer. It's also recommended to shake the product very well. This is important because since the probiotic is mixed directly with the oil suspension, if the probiotic is just sitting for a lot of time, the probiotic powder just is in the keeps, let's say, it's moves to the bottom of the product, and this just does not allow the correct dosing to be given. So we always recommend the product to be shaken well, and then you simply open the cap and press the rubber dropper for the drops to flow. Okay. And then this is also interesting because it's not that common for other products that for babies. You can just take out the plastic dropper to sterilize it if mothers are just worried that it's dirty. And then just before we finish, this probiotic does also appear in US and Canada guidelines of probiotics. It has the highest level of recommendation due to its clinical evidence, and therefore it's supported by medical societies in the US and Canada. Okay. And then to finalize, as a summary, this would be the USP that we recommend for this product. We would say that it's a probiotic with bifidobacteria. Bifidobacteria is a bacteria that is well known between pediatricians because they know it impacts babies' overall health. So I would say that it's interesting that that when talking about the product, bifidobacteria is mentioned. It's used to treat colic and other digestive issues in babies, promoting a healthy microbiota development since birth. Okay. And that would be it. I would suggest I will give my word to Marta so that she can do her part of the presentation. And like yesterday, we can do the questions at the end, if that's all right.
Hello, everyone.
Thank you very much for your presentation.
So I'm going to share my screen, and I'm going to introduce myself because I was not in yesterday's training. I'm Marta Perez, and I'm a microbiologist specialized in probiotics and gut microbiota. I've been working in the R&D department of AB Biotics for 5 years and a half, more or less. So in this presentation, I want to deep in the science behind of these messages that Claudia just explained to you. Okay. So I want to introduce the concept of the infant's gut microbiota and some differences with the adult gut microbiota. Also to introduce the infant colic, which is the disorder that AB Colic Care aims to treat mainly. Regarding the science behind this product, we will understand the mechanism of action, a little bit about the safety, and I will highlight the main clinical studies. So the human microbiota is defined as all those microorganisms that live in and on us, and the higher concentration is found in the gastrointestinal tract. There are more bacterial cells than human cells, and this gives us an idea of the importance of this ecosystem for human health. Indeed, the gut microbiota plays essential roles in having nutritional functions and also in the control and development of the immune system. The infant gut microbiota the microbiota evolves during our lifespan, and we are born sterile. Also, there is some different theories on this, but mainly we are sterile, and as soon as we are born, we start to be in contact with microbes from our mothers and from the environment. So during the first 1,000 days of life, there is this time of establishment of the gut microbiota that is considered a window of opportunity where probiotics can help with the healthy development of this community. There are several factors that affect the establishment of the gut microbiota. The main factors are the gestational age, if the babies are born term or preterm, the delivery mode, if they are born vaginally or by C-section, and the feeding type, if they are breastfed or formula fed. And there are other factors that also influence this development, such as if the baby lives in a rural area versus a city, or if there are siblings or pets in the family. The development of the gut microbiota, the correct development, is essential because abnormal establishments have been associated with an increment of having a higher risk of having autoimmune, inflammatory, and metabolic disease at long term. Among the groups conforming the microbiota of infants, there is a group, the bifidobacteria, that are especially affected by all of these modulating factors. The bacteria is the dominant group when we are born, and also the proportion changes through our lifespan. There is always presence of bifidobacteria, and this is indeed a biomarker of health. Among the different species of bifidobacteria that can be found in the human gut, Bifidobacterium longum is the most stable species and is found in both infants and adults. There is a very interesting symbiosis between human milk and bifidobacteria. And this is because the human milk contains human milk oligosaccharides, HMOs, that are the third more abundant compound. And these are carbohydrates that cannot be digested by the infant's gut, but they can be used by some specific bifidobacteria. The bifidobacteria consumes the HMOs and produce other compounds such as acetate and lactate that feed other microbes. These other microbes can produce, for example, butyrate, that is a compound associated with health and that helps with the development of the intestine mucosa. With this metabolism, the bifidobacteria using the HMOs helps with the establishment of other microbiota members. So I think that the fact that the mother, the mother spends energy producing a molecule that will be used by bifidobacteria gives us an idea of the importance of this group for the baby's health. So now that we have introduced and know a bit more about the infant's gut microbiota, I'm gonna define what is the infant colic, since AB colic care was specifically developed to treat this disorder. Infant colic is defined as recurrent, prolonged, and resorbable crying episodes that do not have an apparent cause or an organic cause. Although it fades away around 4 or 5 months of age, the fact that it's inconsolable is very disruptive and can really affect the quality of life of the family. It is linked to maternal postpartum depression, early weaning, and even some other conditions in the long term. The pathophysiology is not well understood. It's probably multifactorial. There are several factors such as gas accumulation, immature gut, or even parental anxiety. But the latest studies have found there are 2 factors. One is the dysbiosis of the gut microbiota. This is an imbalance between the healthy and unhealthy bacterial groups. There is an increase of enterobacteria and decrease of healthy associated bacteria such as bifidobacteria or lactobacillus. A part of this dysbiosis, there is also an intestinal microinflammation, and this has been shown, for example, with the marker calprotectin, which is a marker of gut mucosa inflammation. It has been observed that babies with colic have significantly higher levels of calprotectin compared with healthy babies, and this is independent of the feeding type of the infants. So considering all of this, we have developed AB colic care that contains these 2 strains, Bifidobacterium longum subspecies longum CCT7894 and Pediococcus pentosaceus CCT8330. These 2 strains were specifically selected for having unique and different mechanisms of action that are also complementary and synergistic. So I'm going to explain a little bit more about the mechanism of action of this strain. Started with the B longum strain. This strain, we confirm that this strain is able to use the HMOs, the human milk oligosaccharides. We did this through an in silico analysis in the genome of the strain, looking for genes associated with the digestion of HMOs. We found that it has several genes, including one enzyme that is known to use the HMO lacto N tetraose, LNT. After the in silico analysis, we did an in vitro test growing the strain in a medium with LNT as the unique carbon source. So we observe a growth, and this confirms the ability of the strain to use this specific human milk oligosaccharide. This also points out that the strain is well adapted to the infant cat. And with this cross-feeding ability that I explained before, we know it will help with the development of the and the promotion of the healthy microbiota establishment. The Belongum strain also produce a very interesting molecule that is called polyphosphate. It's probably not very well known, but recent studies have shown that this molecule is able to protect the intestinal barrier and reduce the permeability, which is always linked with the inflammation. The screening including several bifidobacteria and lactobacillus probiotic strains, and we found that the Belongum from the A. coli care was able to produce the very high levels of polyphosphate. This was, in fact, quite surprising. So when we observed this outcome, we studied deeply this characteristic. We also observed that in presence of the HMO LNT, the production of polyphosphate was so there is some kind of interaction between these two molecules that is very interesting for infant health. In addition, we confirmed that the polyphosphate produced by this strain was able to increase the epithelial resistance in vitro models and other markers of barrier integrity. So we know that this molecule produced by the strain will reinforce the gut barrier of the babies. In terms of anti-inflammatory effects, the Pediococcus pentosacius strain was tested in different models of intestinal inflammation in mice. And we have observed several outcomes confirming that it can ameliorate the intestinal inflammation. One of these outcomes is the regulation of cytokines with a reduction of pro-inflammatory cytokines and a significant increment of anti-inflammatory cytokines such as ALT10. In fact, in the past, we have observed an increment of the production of this cytokine by macrophages that when they co-culture with the Pediococcus strain. In addition, the Bifidobacterium longum produce acetate, which is a very well-known short-chain fatty acid that has anti-inflammatory activity. We also studied the capacity of the strains to inhibit pathogens to test the ability to rebalance this dysbiosis that happens in the gut of colicky babies. We tested the ability to inhibit the growth of several enterobacteria and that are abnormally abundant in the gut of babies with infant colic, and we expand the analysis to other microbes that are associated with neonatal infections. So we tested the Belongum strain, the Pediococcus strain, and the combination of both strains. And we observed that the strains were able to inhibit a broad range of pathogens with between 70 and 1% of inhibition of the pathogens growth. And we studied a little bit more about this inhibition. We know that these strains are able to produce potential. And in fact, when we neutralize the samples, we lose some of these potential, but there is still some inhibition, suggesting that there are other compounds. And we confirm by in silico analysis that the strains harbor bacteriocins. These are antimicrobials of proteinaceous nature. Interesting, such as, for example, the case of inhibition of this salmonella. When we combine both strains, the neutralized samples have higher effects than the strains alone, suggesting a synergistic effect of the two strains when combined. We also study the effect of the strains together in a model of the gut barrier. First, we confirm that both strains can adhere efficiently to the intestinal epithelial cells, and this suggests that it can be a really close interaction. In fact, we observed that the two strains alone, the two strains in combination, but not the strains alone, can significantly increase the expression of some proteins that are associated with the barrier function. So we know that the strains have a synergistic effect, upregulating proteins that are crucial for the maintenance of the intestinal barrier. So as a summary of the mechanism of action of the strains, the below can promoting the normal development of the intestinal microbiota. It produces polyphosphate, that is a molecule that protects the gut barrier. It also produces acetate, an anti-inflammatory molecule. The Pediococcus strain can reduce inflammation, regulating the cytokines, and both strains can inhibit range of pathogens, having synergistic effects, can adhere efficiently to the intestinal epithelium, and they have a protective effect in the gut barrier, also in a synergistic manner. I'm going to go quickly about the safety of the strains. These species, both in human milk and in the gut microbiota of healthy infants. We have assessed all the safety requirements according to the EFSA, the European Food Safety Authority guidelines. And we know the strains are safe. They do not have transferable antibiotic resistance or virulence factors. They don't produce undesired compounds or have any undesired enzymatic activities. And the strains do not produce any adverse events. This was confirmed by studies of safety in mice and also by all the clinical trials. And they have the qualified presumption of safety of the EFSA and also the self-affirmed GRAS condition by the FDA. So moving now to the clinical trials, this product has 4 published trials. And the first one is a pilot trial with 20 babies with a placebo-controlled design that took place in Spain. And the population has infant colic, and we observed a higher reduction of the crying time in the group treated with colic care. As these results were very promising, it motivated us to conduct higher or bigger clinical trials with a bigger sample size. So I will explain in detail the second trial with 100 babies that took place in China, and it's a randomized double-blind placebo-controlled trial. Then we ran an observational clinical trial that expanded the population to not only infant colic, but also babies with constipation. And finally, I will explain the very new trial that compares the efficacy for the treatment of infant colic of AV colic care and Lactobacillus reuteri. So moving to this trial that took place in China, the babies were diagnosed with infant colic according with Rome 4 criteria. And in this population, they were mainly exclusively breastfed, and they took the colic care for 3 weeks. The groups, well, there many factors were assessed during the recruitment, and the analysis showed that the population was well balanced at baseline. In terms of results, we observed a significant reduction of the crying and fusing time in the AV colic care group compared with placebo from day 7, so confirming that the effect is quite fast from the first week of treatment. And this difference was for the rest of time points analyzed at 14 and 21 days. Concordantly, the number of episodes per day were also significantly reduced in AV colic care group from day 7. We also analyzed a responder rate that was defined as babies that have a reduction of at least 50% of crying time. And we confirmed a significant difference between the placebo and the colic group, with 36% of responders in the placebo group and 83% in the colic care group, and this difference was significant through all the treatment period. In addition, we confirmed, together with the first pilot trial, that there were no adverse effects. In this observational study, it having both colic and or constipation, so two different functional gastrointestinal disorders. They were diagnosed according with ROM4 criteria, and they took the probiotic for 2 weeks. In this population, we included babies breastfed, formula fed, and also with mixed feeding, and with vaginal born by vaginally and by C-section. In this case, we measured the relief of the severity of the symptoms with a 5-point Likert scale, and also the parental anxiety with a validated questionnaire. We observe a significant reduction of the total severity of constipation and infant colic, and we confirm this outcome when we analyze the subpopulation of infants with colic and the subpopulation of infants with constipation. So we confirm that AB colic care can reduce the severity of both infant colic and also constipation. In addition, we observe a significant reduction of parental anxiety after the treatment. As I said, in this study, we have a more heterogeneous population in terms of feeding type and delivery modes, and we wanted to test if the colic care effect was maintained independently of these characteristics. As I mentioned during the introduction, the feeding type and delivery modes are key factors that affect the development of the gut microbiota. And since the colic care may interact with the gut microbiota, we wonder if this could affect the efficacy of the product. Fortunately, we confirmed that the colic care was able to reduce the severity of the colic and constipation in formula-fed, mixed-fed, and breastfed babies, and also in babies born by C-section or vaginally. So we confirm the probiotic can have a beneficial effect in all kinds of patients, independently of feeding mode and delivery type. Finally, I want to highlight this trial that was published 2 months ago, and it's a head-to-head comparison with the very commonly used probiotic for infant colic, Lactobacillus reuteri DSM 17938. This was a multicentric, randomized, and single-blind international trial that took place in Spain and Mexico. Babies were again diagnosed with infant colic by ROM4 criteria. They took each probiotic in the commercial dose for 3 weeks, and in this case we have both breastfed and formula-fed babies, being formula-fed the majority of the population, and we also have vaginally delivered babies born by C-section. We measure the daily and crying and fusing time, and also the responder rate as in the previous trial. Looking at the outcome of the crying and fusing time, we observe a reduction over time with probiotics expected to observe a significantly higher reduction in the AB colic care group compared with the reuteri. This difference was observed from day 7 and maintained along the study period. Accordingly, the responder rate was significantly higher in the AB colic care group compared with the reuteri, with around 60% of responders in AB colic care versus 37% in the reuteri group at day 7, and the difference was significant at day 14th with a trend at the last time point. In addition, we analyzed these results considering the different subgroups of formula-fed, breastfed, vaginally delivered, or born by C-section, and we confirmed that the baby colic was superior, also considering these different subpopulations. We have published this part of the clinical outcomes, let's say, but we are also analyzing the gut microbiota to understand better the mechanism of action of AB coli care compared with this other probiotic. We hope to be able to communicate those results soon. So as a summary, the strains that form AB coli care are strains of human origin. Specifically, they are isolated for the fecal samples of healthy babies. They belong to a species found in breast milk and infant gut. They contains a bifidobacterium longum. Bifidobacterium is an essential group for the infant gut microbiota, and this strain is specifically able to consume HMOs. Regarding the mechanism of action, the strains can inhibit a broad range of opportunistic pathogens. They can synergistically protect the gut epithelium. They have anti-inflammatory activity. The strains are completely safe, and we have clinical evidence demonstrating the efficacy in the reduction of the infant colic, a superior effect than the competitor Lactobacillus reuteri, and this efficacy is independently of the baby feeding and delivery modes. And as Claudia mentioned before, this product is recommended in the Alliance for Education of Probiotics of the USA. Okay. So this was all from my side. Well, I think now it's time for questions, if you have any.
Very much, Marta, for your presentation, also Claudia. So yes, if you want, please now share the questions.
Thank you so much, Claudia and Marta. Dr. Ali, do you have any question?
I don't see what this. You mean babies with celiac disease, I guess. It was specifically for infant colic, but celiac disease is not a contraindication for its use. Even maybe it helps with the protection of the gut barrier, considering all the mechanisms of action.
So one more. I have just one question. In past, I don't know if I correct or not, but I thought that maybe colic care we can use just one drop per day, not as 5 drop once a day. If so, if we can, or the dose of AB colic care, it must be 5 drop per day. So our droba, 8 ml droba, I mean, how it will be used for 1 week, 2 week?
Well, normally the dose is 5 drops per day, and the bottle lasts for about 1 month. So that's the recommended treatment.
So 5
Okay,
drop per
in your
day.
case, you have
8
the blue dropper.
Sorry, yes.
And the
Yes.
blue dropper is designed to give the daily dose with 5 drops. So you need to give the baby 5 drops per day, and the bottle will last for 1 month, for 28 days. You have the treatment.
Okay. Dr. Ali, do you have any question? Any further question?
I think there was a question from someone else, from Mr. Saleh, maybe.
I have one question so far. I have one question, please.
Yes.
Can we use AB Care inpatient? I mean ICU patient for babies?
You mean newborns? You mean babies that are in
Yes,
the
baby
hospital?
And then you see
Yes.
Inpatient.
Mhm.
Yes, yes.
Yes.
So,
well, we have
yeah, go ahead, Marta.
no, I wanted to say that we don't have safety data in this kind of population, but I know that sometimes pediatricians recommend it anyway. So I think it will be more something at the discretion of the specialist. But we
Okay,
don't have
very good.
specific data in this population.
Okay, thank you.
No problem.
So that's all. I think there's no more question. So thank you, Marta and Claudia, for your presentation. Also, thank you, Paul and Caesar, for all who join us.
Yeah,
Thank you
you
for
all
your
for
time.
joining.
Thank you.
Regarding any other questions that you might have, you can always write to us, and we will try to reply as soon as possible. And Firas, we keep in touch to organize the next training for the next product, AB Intimus, that we need to coordinate it with our team to see what are the feasible dates and the dates that work also for you and for your team.
Okay.
Thank you.
Thank
Okay,
you.
so thank you very
Thank
much
you.
for
Bye-bye.
attending. Have a
Bye-bye.
nice day.
Thank you.
Have a nice day.
Bye.
Bye.
See
Bye.
you.
Bye.